Here's erythromycin here. So what is erythromycin? Erythromycin is an antibiotic that fall under a group of or a family of antibiotics called what? Macrolide. Yes, and erythromycin is a protein synthesis inhibitor. Wait, let me tell you more, okay? Because in this video you are going to learn about the uses of erythromycin. Not only the uses of erythromycin, both the side effect of erythromycin. Okay, so number one, what is erythromycin? What is erythromycin? Just as I explained earlier, it's an antibiotics, a protein synthesis antibiotics that fall under a group of macrolide. Macrolide antibiotic. And one thing you're going to know about erythromycin is that it is a prototype of what? Macrolide antibiotics. It is the first macrolide antibiotic that is being found. Okay, so erythromycin here is the first macrolide antibiotic that is being found before they start searching for other antibiotics like clarithromycin, azithromycin, so on and what so forth. Okay, so now what are the uses of what? Erythromycin. Okay, uses or indication. Okay, uses or indication of what? Erythromycin. Erythromycin is used to treat strep, or you call it streptococci or streptococcus. Okay, so because erythromycin can be used in the treatment of streptococcus or strep, okay, so it can work for what? It can work for pharyngitis. It can work for what? Pharyngitis. So erythromycin can treat pharyngitis, a throat infection, okay? Infection of the throat. And also it can also be used for the treatment of what? Tonsillitis. You understand? Tonsillitis, pharyngitis, as I stated earlier, pharyngitis. Why? Because inhabit a disease that do cause what? Tonsillitis and pharyngitis, otherwise called what? Streptococcus. Yes, called streptococcus. Okay, so streptococcus is the bacteria that do cause, is the disease that do cause tonsillitis and what? Pharyngitis. It can also be used for what? Rheumatic what? Fever. In the treatment of what? Rheumatic fever. Because strep are one of the cause of what? Rheumatic what? Fever. Erythromycin can be used for the treatment of what? Skin and soft tissue infection like cellulitis, boils, and other forms of what? Rashes like impetigo. Okay, so why? Because it works against a disease that do cause the bacteria of skin and soft tissue infection, which is called what? Staph. Okay, Staph aureus or staphylococcus. I call it staphylococcus. Okay, so staphylococcus this cause what? Skin and what? Soft tissue what? infection. Okay, so staphylococcus is the cause of skin and soft tissue infection. So erythromycin can be used for the treatment of staph. Okay, so if you treat staph, you get rid of what? Skin and soft tissue infection. Is for erythromycin, or another use for erythromycin is for what? Neisseria. Call it Neisseria. Neisseria. So this Neisseria disease is the cause of what? Gonorrhea. So erythromycin can be used for the treatment of what? Gonorrhea what? Infection. Okay, because Neisseria is the cause of what? Gonorrhea. Okay, so erythromycin can be used for the treatment of what? Gonorrhea infection. Okay. Okay, here is another one use of a what? Erythromycin. Erythromycin fight against the disease called what? Treponema pallidum. It fight against the disease called what? Treponema pallidum. So this disease is the cause of what? Syphilis. Is the cause of what? Syphilis what? Infection. So because it treats Treponema pallidum, erythromycin can also be used for the treatment of what? Syphilis. Okay. Erythromycin mechanisms of action. The way they stop bacteria or inhibits bacteria from growing is by binding their 50S ribosomal subunit. The bacteria has two ribosomes, as the 30S and the 50S, and the 50S ribosome. So it acts by binding the 50S ribosomal subunit. That is how it inhibits the growth of what? Bacteria. One is what? Diarrhea. Number one side effect of erythromycin is what? Diarrhea. Number two side effect of erythromycin is what? QT word prolongation or long QT. Okay, call it long QT. Okay, this long QT is irregular heartbeat. It causes irregular heartbeat. Okay, so long QT is what? Irregular heartbeat. It makes your heartbeat to beat too faster. Okay, so one of the side effects is what? Long QT. Another side effect. Sorry, when I say diarrhea, and number two I said long QT. Yes, which is the irregular heartbeat. And number three is what? GIT upset. Okay, GIT upset, gastrointestinal tract upset. The GIT stands for gastrointestinal tract. GIT upset. So though this side effect is bad, but somehow useful to some patient. Okay, why I say it is useful to some patient is that it can cause it can trigger a lazy intestine, in assumption that, let me say, afterwards surgery, maybe after surgery, in some patient after surgery. After surgery, erythromycin can be used. After surgery, erythromycin can be used to trigger what? Lazy intestine. Yes, after surgery, erythromycin can be used to trigger lazy intestine. Let's say the intestine is too dormant, that maybe if you eat, it took a longer period of time for digestion to take place. So erythromycin can be used to trigger what? Lazy intestine. Okay. So there are other side effects, you understand, of what? This medicine called what? Erythromycin. And erythromycin also can also work for some other things that I did not mention here. Okay. So my advice for you is that you do more research before taking your erythromycin. Okay. Tell your doctor that you have a diarrhea. Tell your doctor that you are suffering from irregular heartbeats before taking erythromycin. Please state your problem down to your doctor, or if you are on any other medication, also let your doctor know before taking what? Erythromycin. Thank you so much, guys. But remember, erythromycin is not advisable to be used. During what? Okay, let me say. It is not advisable. Erythromycin is not advisable to be used during pregnancy. Yes, erythromycin is not advisable to be used during pregnancy. Okay. Thank you so much, guys. I'm so grateful. Please do well to subscribe to my channel. Okay. So we keep on producing good video like this and something better. Okay. Thank you. God bless you.